Amlodipine introduction. Amlodipine is a long-acting calcium channel blocker, CCB. It is used to treat high blood pressure, hypertension, and angina, chest pain. Amlodipine comes in various forms: besylate, mesylate, or maleate salts. It selectively inhibits the influx of calcium ions into cells. Popular brands include Norvasc. Mechanism of action. Amlodipine blocks L-type calcium channels in vascular smooth muscle cells, primary action. Cardiac muscle cells, secondary action. N-type calcium channels in the central nervous system, linked to pain perception. It reduces vascular resistance by preventing calcium-induced contractions in vascular smooth muscle. Stable angina. Amlodipine lowers myocardial oxygen demand by reducing total peripheral resistance, afterload. Variant angina. It prevents spasms of coronary arteries and restores blood flow. Amlodipine also acts as an anti-mineralocorticoid by blocking mineralocorticoid receptors. It does not affect serum calcium levels. Side effects. Side effects are rare, but may include low blood pressure, hypotension, fast heart rate, tachycardia, peripheral edema, dizziness and fatigue, flushing or warmth sensation. In dogs, amlodipine can cause gingival hyperplasia. Contraindications. Amlodipine should be avoided in severe hypotension, very low blood pressure, cardiogenic shock, failure of the heart to pump adequately, known allergy to amlodipine or its components. It should be used cautiously in pregnancy and breastfeeding, limited data on safety, liver impairment as metabolism occurs in the liver, heart failure due to the potential for worsening symptoms, drug use as monotherapy or in combination monotherapy. Amlodipine is effective as a standalone treatment for hypertension, high blood pressure, stable angina, chronic chest pain, variant angina, vasospastic angina. Combination therapy. Amlodipine is often combined with other drugs to enhance efficacy. Amlodipine and valsartan. This combination treats hypertension by combining a calcium channel blocker with an angiotensin receptor blocker, ARB. Amlodipine and benazepril. This combination uses an ACE inhibitor for better blood pressure control. Amlodipine and hydrochlorothiazide. This combination pairs with a diuretic for managing hypertension. Amlodipine and atorvastatin. This combination helps manage both hypertension and cholesterol. Amlodipine and olmesartan. This combination uses an ARB for improved antihypertensive effects. Most popular international brands containing amlodipine: Norvasc manufacturer, Pfizer country, United States of America. Istin manufacturer, Pfizer country, Ireland. Amlor manufacturer, Sanofi country, France, Vascalpha. Manufacturer, Alpha Pharma country, India. Asamex manufacturer, Emcure. Pharmaceuticals country, India. Adverse events. Common side effects: dizziness, peripheral edema, swelling, particularly in the legs, flushing, warmth or redness in the face, fatigue, nausea. Rare side effects: gingival hyperplasia, mainly in dogs, tachycardia, rapid heartbeat, hypotension, low blood pressure. Food-related considerations. Amlodipine can be taken with a meal or on an empty stomach. There are no significant interactions with specific foods. Drug interactions. Other antihypertensive agents. Amlodipine enhances the blood pressure lowering effect when combined with beta blockers, for example, metoprolol. ACE inhibitors, for example, enalapril. Angiotensin receptor blockers, RBs, for example, valsartan. Diuretics, for example, hydrochlorothiazide. CYP3, A4 inhibitors, drugs such as ketoconazole, etraconazole, or erythromycin, can increase amlodipine levels, leading to enhanced effects. CYP3, A4 inducers, rifampin and St. John's wort, may decrease amlodipine levels, reducing its effectiveness. Simvastatin, co-administration of amlodipine and simvastatin may increase the risk of statin toxicity. It is advised to limit the simvastatin dose to 20 milligrams per day. Grapefruit juice. Grapefruit juice increases plasma concentrations of amlodipine, so it is important to monitor for enhanced effects. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs may reduce the antihypertensive effect of amlodipine. Other interactions. Use caution when combining amlodipine with drugs that alter heart rate, such as digoxin or antiarrhythmics. Food interactions. General food. Interaction. Amlodipine can be taken with or without food. Food does not significantly affect its absorption or efficacy. Grapefruit juice. It is advised to avoid excessive intake of grapefruit juice, as it can elevate amlodipine levels in the blood, increasing the risk of side effects such as hypotension or dizziness. Pharmacology class. Amlodipine is a dihydropyridine calcium channel blocker, CCB. Mechanism of action. Amlodipine blocks calcium ions from entering vascular smooth muscle and cardiac muscle cells. It causes vasodilation, lowering blood pressure, and reducing the workload on the heart. Therapeutic uses. Amlodipine treats hypertension, stable angina, and variant angina. It is used in both human and veterinary cases, such as systemic hypertension in cats and dogs. Pharmacodynamics. Onset of action. The onset of action occurs 2 to 4 hours after oral administration. Duration of effect. The duration of effect lasts 24 hours, allowing for once daily dosing. Primary effects: reduces peripheral vascular resistance, decreases blood pressure, improves oxygen delivery to the heart in angina patients. Pharmacokinetics absorption. Amlodipine is well absorbed orally with a bioavailability of 60 to 65%. Time to peak concentration. The peak concentration occurs 6 to 12 hours after oral administration. Distribution. Amlodipine is highly protein-bound, with 93 to 98% of the drug binding to plasma proteins. Metabolism. Amlodipine is metabolized in the liver primarily by CYP3A4 enzymes. Elimination. Half-life. The elimination half-life of amlodipine is 30 to 50 hours, contributing to its long duration of action. Excretion. Amlodipine is mostly excreted via urine as inactive metabolites, 60%, and feces, 20 to 25%. Amlodipine maximum daily dose. The recommended maximum daily dose is 10 milligrams for adults. For children aged 6 to 17 years, the maximum dose is 5 milligrams. Veterinary use. Dosage varies based on species and condition. Chemistry. Chemical formula C20H25, CLN 205. Molar mass 408.88 grams per mole. Melting point 178 to 179 degrees Celsius, pure form. Solubility, slightly soluble in water, soluble in ethanol and methanol. Organic molecule class, dihydropyridine calcium channel blocker. Bioavailability, 60 to 65% following oral administration. Pharmacokinetics, recap absorption. Well absorbed with slow release over 6 to 12 hours. Protein binding, high, 93 to 98%. Metabolism, predominantly in the liver via CYP3A4 enzymes. Elimination. Half-life, 30 to 50 hours. Excretion, mainly through urine, 60%. References. Goldman Cecil Medicine Country, United States of America. Date, 2012. Study. A comprehensive guide on clinical medicine. Findings. Detailed description of amlodipine's therapeutic uses and pharmacology. Analog-based drug discovery. Author Fisher J. Ganelin CR Country, Germany. Date 2006. Study, analysis of calcium channel blockers. Findings, discuss structural properties and analogs of amlodipine. European Medicines Agency, EMA Country. Europe. Date 2022. Study, report on nationally authorized medicines. Findings, safety and efficacy. Evaluations of amlodipine. World Health Organization, WHO, Country. Global. Date 2023. Study, model list of essential medicines. Findings, highlighted amlodipine's essential role in managing hypertension. Daily Med, Norvasc Product Information Country, United States of America. Date 2019. Study, FDA-approved labeling. Findings, pharmacodynamics, dosing recommendations, and side effects.